Hello folks, my name is Travis and welcome to the video. Um, in this video, I will be talking about a guide that I created specifically for people who experience a developmental disability and are getting ready to either experience a complex medical procedure or a surgery. Before we go any further, let me state for the record as a disclaimer, I am not a medical professional by any means. So please understand what I'm about to talk about is the guide I created to help minimize the stress for a caregiver providing support to a patient, which in this case, the guide is intended to help people between the ranges of 5 to 25 minimize their stress to help the patient's recovery go much smoother and make the discharge planning after a major procedure not have as many challenges when the person or patient rather returns home. The first thing that needs to be addressed when planning for one of these types of procedures is what kind of wound care, what kind of aftercare is there going to be, such as how many times a day will bandages need to be changed? How often will meds need to be administered to help with pain or inflammation? Give you a very easy example of this, okay? Very easy example. As you can see via the video, I am someone who is physically disabled. I experience a very physically limiting disability. So therefore, I've had several surgeries in my life. One of my more recent ones was I had my wrist worked on. When they were done with that surgery, they wrapped my hand in gauze and bandages and then ace bandage wrapping. I was told a couple of things. One, don't get it wet because the stitches need to heal, which meant I needed to have what is called a cast bag for showering, um, which is a bag that goes over an extremity. They make them for your legs and they make them for your arms. Um, when you're talking to the doctor and you're you're asking what does the aftercare look like, sometimes doctors will forget to mention there'll be stitches, you know, along a certain area, or the incision area can't get wet, for example, if it's a major surgery. Sometimes the major surgery, the area getting wet, it won't affect it very much. It won't affect the stitches, but more often than not, it's going to. So what you'll want to ask is if there's any open wounds or stitches that I need to monitor, if they get wet, what do I do, if anything, or how can I minimize uh, that from happening? And, you know, what kinds of pain meds are you going to administer for inflammation and pain? Um, as the caregiver, whether you're a parent or a paid staff of a patient, an example of this would be And again, I'm just going to use myself as an example here. Um, if you're get if they say we're going to give you tramadol for pain, and you're going to take tramadol for pain so many hours, and then you're going to need to take um, like an ibuprofen or Tylenol for inflammation. They're going to prescribe all that stuff to you. They'll know better than most what's going to work and what won't. Now, you're going to want to ask, though, are there side effects that I need to watch for under under giving those medications? Now, be very careful. Be very careful when you are thinking about this. Specialists, especially, don't always know every single med out there that someone could be given, especially if you're providing care support for someone who experiences a developmental disability. There's a variety of things the patient could need certain meds for. A, a very important question to ask is, here's a list of the meds that my person that I'm providing care for is on. Is any of the pain management meds that you are going to give going to interact negatively with the meds that I have to provide the patient on a regular basis? Give you an example. Um, if you're given a very strong muscle relaxer, such as um, cyclobenzaprine, for example, sorry about that, I had to think of one, but the person takes baclofen, they both do the same thing. They are a muscle relaxer, but you don't want to give your baclofen to your individual and then also give them cyclobenzaprine. That's why, you really need to make sure that the specialist knows um, what they're taking, and make sure that before the procedure, you know what to give and what not to, given the circumstances. You, as a care provider, though, need to be comfortable with any after wound care that needs to be done, or uh, providing pills and pain management of all different types, and know what a side effect looks like in your patient. Give you an example. Cyclobenzaprine can make, which is, again, as I stated, is a muscle relaxer, that can make you be really, really loopy. Unfortunately, it can also make the person very incoherent. However, you may give a med that, you know, is harmless on its own, helps the patient, and there's no knowledge of anything else. But you need to be able to give a pain med and then look at it and say, is the person okay? You know, are they having nausea? Are they having any of the side effects that could be really bad, such as um, nausea, dizziness, those sorts of things? And you need to ask the doctor what those will be. Yes, they're stated on the medication instructions. However, it's always good to ask what am I in for here when it comes to medication and wound care? Specifically, when it comes to wounds, um, what do you need to look for? Uh, you know, at what point, if the person's skin changes color, should I say this is a bad color? I need to call for some medical advice. Who do I talk to for that? Because it may be a bad color, but it may not be a color that is life threatening. But you wouldn't know. More than likely, you're not going to know that. So who do you talk to before you make a judgment call? Who would be a safe person to call and ask for that? Whether it be that or another example of um, needing to understand aftercare is, let's say your individual, the patient, is experiencing more pain than normal. I myself have a disability in which my pain tolerance is high, but it can very quickly shoot up due to my underlying condition, which is spasticity. Has nothing to do with um, what was done to me surgically, but because surgically I had a lot of work done to me, for example, if I spasm, the pain can shoot up beyond out of control, and I might need more meds. Well, if you need advice on is it safe to give some more than what was prescribed, who is the right person I can call to ask that without um, any um, major delay and a response? The other option for that to help make that a little bit easier to manage, as an example, would be asking if your patients or your individual, however you want to look at it, primary physician, primary physician can be looped in to uh, into what's going to be done for the surgery, what day surgery is being done, all those details, so that if you can't get a hold of the surgeon, you can try to get a hold of the primary doctor and at least ask, what should I do? Now, that being said, nothing is ever cut and dry. So, one of the other things that can happen um, after a surgery, which still is related to meds, and this is in my guide, is depending upon what meds the person was given um, during the medical procedure, they can have additional side effects or additional problems that the individual doesn't normally have. The best example I can give with that is their bodily functions, as in facility wise, are not normal or they become erratic. Generally, the hospital will not let a person be discharged if this goes on for days and days and days. But um, sometimes once it appears that they've gotten it started again, but it's still a little bit irregular, they'll still let a person go home, but they will ask you to give additional meds that weren't originally discussed. A good idea, however, whether you're um, a paid staff or not, and you're going to be providing the care to the individual, is saying, look, they have these physical limitations. You know the best. So if you're concerned that there is a chance that there may be a problem with normal bodily function, as an example, you can say, Are you planning on, or are you willing to consider issuing some meds to help return their bodily function to normal? If the answer is yes to that, you should request, hey, sir or ma'am, physician, can I please get the names of the meds that you think you might prescribe for those situations, and scripts for them before you discharge them, or maybe even before surgery, so that I can go get those scripts filled and have them on hand when the person returns back to their residence or back home, whichever uh, situation it is. Generally, you're going to hear, "Sure, let's talk about it." Um, the other thing that comes to mind, though, which supersedes the meds, for example, is if you're not comfortable with how many times a day somebody needs to take a med, and you need to help them get that, and then you need to monitor them for how long, um, is saying, my situation in which I support this person is such that I don't feel comfortable providing all of this care, um, when they return back to their residence. Um, is it go? Is there an option that, for example, um, they are allowed to stay in the hospital a little bit longer till they're past the stage of needing their bandages changed regularly, because I'm not comfortable doing that, or at least letting them stay in the hospital till they're not on so many meds, because I'm not comfortable having to remember all the meds that are being administered. If the answer is no, you have, um, another option you can ask. Is there a possibility of there being a request submitted by the doctor? Could we possibly request having submitted for a in-home nurse to come in and at least help monitor the patient's health and make sure that the things that the doctor is concerned with are adequately looked after? Now, when you say that sort of thing, two things you need to keep in mind. One, you need to explain your situation, not just the patient's, but yours. Do you have other children at home, for example? Do you have, a job in which you're not going to be able to be home the entire time they are recovering? Your employer needs you to, go to work more, or continue working on a more regular basis, and you're not going to be able to provide the support. Another thing that goes in hand with that is there going to be physical therapy or occupational therapy provided, for the individual after, or be needed after surgery? Best example I can give of that would be, I just had my knee replaced last year. Well, that requires physical therapy, but they don't do all that physical therapy in the hospital. They do enough to get you out the door, but they don't do it till you're completely healed. It's not normal. Generally, they expect somebody to be up and walking after 21 days of, uh, having had surgery. Yeah, well, as most of you know that are probably watching this video, somebody with a developmental disability, depending upon what their diagnosis is, that may not happen. It's not something that's a common occurrence, folks. So generally, they'll say therapy is needed. In a case like that, you can ask, is there a specialty machine that we can request getting rental from the insurance so that it does the therapy for me so I'm not doing it if you're not comfortable doing it. If you are, then they'll just set you up with a therapist. The therapist will give you exercises, and then you perform the exercises with the patient. If you're not, ask if there's equipment that can be rented or requested through medical prescriptions to be rented so that the person can recover. Um, and as a prime example of that, there are. I can safely tell you, depending upon the procedure, there usually is medical equipment that can be requested via the doctor to help with recovery, whether it be at home or um, at a group home facility. If the person happens to live at one of those, you can usually request get those referrals sent in for whatever it is. But you have to ask the doctor about that. They don't usually just volunteer like we're going to do this unless they've done several disability medical procedures. But even then, it's always good to ask, is there something we can request to help with that? And also, here's what's important for you and for the patient in regards to that. You need to ask, how much physical therapy do you want this person doing? And do you expect that to be um, where they had to be taken to a outpatients facility, or do you recommend other means? If they say normally we prescribe therapy, but we send them over to this place or this place for therapy, which they'll list a bunch of places. If that, if you think as the care provider that's going to be too difficult based on your situation, whatever that is, you have another option. You can say, um, we're willing to do that, but is there a possibility of requesting in-home therapy? Now, when you ask for that, you are going to have to say something along the lines of, the reason I'm asking is because I have to work a lot. One, I'm not comfortable in doing range of motion therapy by myself to the individual because I'm not a licensed therapist. I'm either their paid staff or I'm their parent, and I'm really worried about hurting them because this is such a complex situation. And I'd prefer a professional do it. Um, and I'm not going to have enough time to take them to a multitude of appointments. And you can also say, even if you're willing to do a to do those outpatient appointments, if you're not comfortable providing the range of motion in between those appointments, I'm also concerned that without more regular therapy, at least during the recovery, that the surgery won't be as much of a benefit. Now, if you're a care staff, that kind of question gets a little tricky. It depends on your organization's rules, but in that case, you can ask on behalf of the individual, unless the individual knows or wants to ask themselves, can we have a licensed therapist come to the facility, please, to do the therapy because I am not certified or allowed by the organization that supports said individual or patient to provide that kind of therapy. And I am one staff and, I have more than one client to take care of. Just as an example, that may sound harsh to spell that out, but when you are asking for support, sometimes you have to say, I don't feel comfortable, or I don't have enough time because I'm responsible for a multitude of people. And I'm just one person. Or if you're a parent, you could say, I'm willing to learn, but I also am requesting in-home therapy because I don't have the ability to easily transport them back and forth to therapy 2, 3 times a week. I have a vehicle that they can go into, but it's not easy to get them in and out. And especially now, because of whatever the surgery is, it's going to be even more difficult for me to move them in or out of my car in order to take them to and from. Or I'm worried about the vehicle I'm using being too bouncy and hurting them. Just a couple ideas. And that goes the same if you're a paid staff as well. A paid staff can say, I'm not comfortable with administering range of motion because of what's been done, and I'm not certified. Same thing goes with the medications. You can say, I would prefer an in-home nurse come in to help administer those. Now, you may get told no, even if you explain, I am not trained to medically dispense meds. It is my kid, but this, I'm not familiar with these medications. Um, you know, I want somebody that I could call, and I want that to be my physician, like I mentioned earlier. However, you can also say, I really would prefer a nurse come by and check on us at least once a week to make sure that I'm doing everything correctly if you're a parent. Or if you don't have enough time and you need a nurse's help to provide care. That's another reason. If you're having to work at home just so that somebody's there to help, but you are busy and you can't get enough time off to make sure the person's okay and provide adequate care due to the level of disability they need, again, their level of disability will dictate how much support they need. But that leads into, can I get a home nurse? It's a multitude of things. This is just a guide. These are just things to think about, folks. But ultimately, the most important thing that you need to consider, there are two things that you need to think about. Do I need somebody at the table to help me help the person or the patient I'm providing care for, whether it be my child or an individual, to make sure their recovery is as smooth as possible? Because nobody's perfect, folks. Nobody is. And you might need that support. Second, and just as important, I don't care whether you're a mother, father, or if you're a paid staff working at a organization that provides care for people with developmental disabilities, take care of yourself. Please, I'm strongly encouraging that. And if you feel like you're getting overwhelmed, you're burned out, you need some help, reach out. Contact your physician. Contact somebody to get help. The one thing I will say, going back one more time, is one of the absolute top best things I think any person that's helping anybody with a complex medical need can do when facing a complex medical procedure or surgery is try to loop in the primary care physician as well, because then you have a multitude of doctors that are helping to monitor the situation. And then you, as the care provider, have multitudes of people who are medical professionals that you can call for advice if you need to. I hope this video helps. If you have any questions about the guide or how the guide can help you in the situation you're in, please feel free to leave comments down below and I will do my best to answer them for anyone that needs some assistance. And again, I cannot stress enough, I'm not a medical professional. This guide's intention is just to help make things a little bit simpler when it comes to discharge so there's not a gap in the person's care. Thank you very much, folks.